All right, welcome back. The Advanced DMT. Again, we're using the Pearson's Advanced DMT, a clinical reasoning approach, the second edition, the updated version. We're going on to Chapter 11, Principles of Pharmacology. All right, so as in the Advanced DMT, you will depend on your state and your region. You may or may not be able to administer a lot of medications for ill and injured patients. I know in my region, in my state, the advanced has a pretty good scope of practice here, and they have a lot of medications, so they can give a lot of medications. So you have to remember, though, that some medications, when you give them wrongly or incorrectly, uh, they could uh, kill a patient, life-threatening consequences. So with that, you have to have a good understanding of pharmacology. And pharmacology, the definition of pharmacology is a study of origin, nature, properties, action of a drug, and their effect on the living organism. We get medications from four different basic sources. They can come from plants, they can come from animals, they can come from mineral, or they can be synthetic or man made. Um, let's do that. Going along with that, like in 1921, insulin was discovered in 1921. Insulin saved uh, the lives of 15 million people with diabetes. Initially, it's mainly derived from the pancreas of pigs and cows. A lot of it now is synthesized or synthetic insulin, so it's not. It's still used, the pigs and cow insulin, but not as readily as what it used to be. You have to keep your medication knowledge up to date, current, by reviewing medication information. You can do this by like your protocols. Uh, but there are some up to date sources like the PDR, the Physician's Desk Reference, the AMA, or hospital formula. These are all good references to keep up on your medications. A medication profile, it will consist of the name, the medication's name, its classification, the mechanism of action, the indication, contraindications, the pharmacokinetics, side effects, the routes, the dose, how it's supplied, and special considerations. And we're going to break all these down in more detail. Medication profile, the name, there's a generic name, trade name, chemical name. For example, aspirin would be generic name, trade name would be like Bayer, chemical name, you just have to look that one up, but there's a chemical name for it. The classification, this is the type of medications. It's usually uh, due to this mechanism of action or the system that it affects, is how it's classified. The mechanism of action is the way the medication achieves its intended effect. So that's what we want the drug to do. The indication is why or when we should use the medicine or the medication. Uh, Pharmacokinetics is how the drug is absorbed, distributed to tissues, and eliminated through the body. So it's a study of this and how it works. Side effects are effects that we don't want to see with the medication, but usually are not harmful, right? Unintended effects, like for example, headache from giving a nitro is a side effect. Routes of administration, this is how we give it to the patient, how we introduce it into the body. Like I say, contraindications are why we wouldn't use the drug. Uh, it means it could be harmful if we give it to certain conditions or certain issues, so we wouldn't want to use this drug for that. Dose is the amount and frequency of medication to be administered. So dose is not only how much we're going to give, but how often we're going to give it. How it's supplied is how it's packaged, the concentrations, and special considerations is special precautions to be observed when we administer a drug to special patients populations. And we're going to talk about that here in a little bit. Uh, Medication oversight and regulation. See, so legislation is made to protect the public and our patients from unsafe and mislabeled medications. There are a few acts we're going to talk about now. The Pure Food and Drug Act of 1906, enacted to ensure proper medication labels. So this is the start of the labeling of the medications. The Harrison Narcotic Act of 1914. This regulated how we imported, how we manufactured, and how we sold and used medications. The Food, Drug, and Cosmetic Act of 1938. Additional protection to the public. It was revised in 52 and 62. This started the FDA, the Food Drug Administration. It called for mandated prescription for addictive or harmful medications, and it required for labeling of medications that included addictive drugs and potential side effects. So we had to, it means you had to have a prescription for certain medications, which we still have today, and it increased the labeling parameters that a pharmaceutical company has to do. So if it's addictive or potentially have side effects, it's got to be, it has to be labeled with that. The Durham-Humphrey amendments were added to the 1938 Act, added in 1951. This again says that pharmacists can only give certain medications following a prescription. And it also defined what OTC or over-the-counter medications are. These are medications you can go to like Walmart's or your drugstores or whatever and pick off the shelf, and it's not required to have a prescription from a doctor. Stuff like aspirin, Tylenol, stuff like that. Certain cold medications, all that stuff. The Comprehensive Drug Abuse Prevention and Control Act of 70, aka the Controlled Substance Act. This replaced that Harrison Narcotic Act of 1914. This is the one that started scheduling the drugs by their potential for being abused. It starts a Schedule 1, which is the highest potential, on down to the Schedule 4, which are least potential for abuse. And it breaks it down here. Schedule 1 is a high potential for abuse, and it has no medical use in the United States. They say like heroin, LSD. Schedule 2 goes to medications with a high potential for abuse or addictive, but they do have some medical use. Example would be morphine, codeine, hydrocodone, these drugs. Schedule 3 are less than Schedule 2, of course, and they have medical use. It'd be the anabolic steroids, the non-prescription painkillers, all this stuff. And then Schedule 4, medications with less potential than Schedule 3, but they do have accepted medical use. Again, these would be our benzodiazepines, some barbiturates, steroid stimulants. And then finally, Schedule 5. Is the least abusive potential. Definitely less than Schedule 4. This would be over-the-counter medications and certain small amounts of controlled substances. Again, with the oversight, medication safety and regulation, the FDA is responsible for testing and releasing new medications, right? They have 4 different testing phases. Special considerations, medications in pregnancy, right? During pregnancy, the female body goes under some different changes in anatomy and physiology. Some would be which their blood volume increases or what their heart rate does. And sometimes we have to worry about this when we give a medication. There's also a risk to a fetus, right? So this is the teratogenic effects. So we have to worry about the fetus too. Is this drug going to affect that baby or the fetus? Pediatric patients, right? They're physically different from an adult. The medications will affect a child different. So a lot of medications for pediatric patients are weight-based. Even our world, a lot of our normal drugs we would give 2 milligrams of this, it's going to be weight-based for our pediatric patients. And geriatric patients, we have to have special considerations because they don't metabolize as well. So they have differences in the absorption, the distribution, their metabolism, and elimination of medications. So their systems don't work as well. So they're going to have a hard time absorbing or metabolizing or even eliminating some medications. Uh, and multiple medical conditions will require medications. So they're on a lot more medications than younger people. We have to worry about stuff like drug interactions and stuff like that. Medication names. They're given an example or trade name, Provenal. The chemical name is what you see there, A1 methyl 4 hydroxide melazine sulfate. The generic name would be albuterol sulfate. The official name is albuterol sulfate USP. Right? This is albuterol sulfate that we use in our dual nebs or just in our nebulizers. Excuse me. We're going to talk about medication forms. They come in a solid form, like a tablet or a capsule or a powder. They can be liquids. They can be like in a suspension, and like water or saline or fluid. They can be spirits, elixirs, syrups, all these other stuff. Semi-solids would be our lotions or creams and our ointments. Our gels, our patches, medical patches are in this category. And then we have gases, which would be oxygen and nitrous oxide. Medications that affect the nervous system. We have some that affect the sympathetic nervous system. They're symptomimics. And then parasympathetic nervous system, they're parasymptomimics, uh, and so on. We're going to talk about the adrenal receptors and how drugs affect them. If something affects the alpha 1 receptors, it'll cause peripheral vasoconstriction. Something affects the alpha 2 receptors, they'll have peripheral vasodilation and little to no bronchial constriction. The beta 1 receptors is going to increase the heart rate, increase the autonomicity, the myocardial contractibility, and increase the conductivity. Yeah, tuvidity. Yep, I'll get it. And then the beta 2 receptors are going to be the bronchodilators and the vasodilations. So if you have something that affects one of these receptors, this will be the outcome. And certain medications will affect these. So we want, like the albuterol is going to affect the beta 2. It's going to cause that bronchial dilation. Epi is going to hit that beta 1 for sure. A little bit of the alpha 2 as well. So, so we'll talk about that when we talk about medications. Analgesic, medications that reduce pain. They're opioid agonists. Non-steroid anti-inflammatory drugs like NSAIDs. So these are our pain meds like morphine, fentanyl, ketamine. They're analgesics. Anti-anxiety or sedative hypnotics designed to reduce anxiety. That's the barbiturates, the benzodiazepines, the non-barbiturate hypnotics. Stimulants. These are what stimulates the nerve system. The caffeine, cocaine, amphetamines. Depressants are going to slow the central nervous system activity. They're used to treat anxiety, muscle tension, stress, pain, insomnia. Anticonvulsants are to stop seizures or to treat seizures. Psychotherapeutics are for treating mental illness, anxiety disorders, or psychic disorders. Respiratory drugs are going to be the over-the-counter medications like our cough medications, stuff like that. The beta 2 agonists, like our albuterol, and the corticosteroids, corticosteroid steroids. Cardiovascular, if it's classification cardiovascular, this is for antiarrhythmia to treat the abnormal heart rhythm. The hypertension drugs for high blood pressure, antiplatelet or anticoagulant like aspirin or what they would call blood thinner. Or fibrogenics, this is the ones that break up the blood clots, right? Like TPA. We got diabetic classification. This is to control blood sugar, like insulin, or there's drugs to control low blood sugar, which is like dextrose, like D10 now. Used to be D50. Immunosuppressants. We use immunosuppressants a lot of times. They'll use them in a lot of situations, but if someone's going to get like an organ donation, they'll be on immunosuppressants forever. So inhibits actions of the immune system, decreases the body's attack on its own tissues, like an autoimmune disease, like lupus or rheumatoid arthritis. Reduces the likelihood that the body will reject a transplant. We kind of talked about that. All right, kind of going into the packaging now. So a lot of times it's packaged according to the intended use. The packaging also protects medication during storage. It's either packaged as a prefilled syringe and vials, non-constituted medications, ampules, or nebules. These are a prefilled syringe. We do see uh, quite a few of these in the field. The top one is Narcan. The bottom one would be epinephrine. So these are the different parts of the prefilled syringe, which will demonstrate this in class. These are examples of vials, non-constituted medication vials. This would be glucagon, which means one's got a solution, one's got the powder, and you got to mix them. These are ampules. All right, pharmacokinetics is a branch of pharmacology concerned with the way drugs are absorbed, uh, dis- distributed, metabolized, and eliminated from the body. Absorption. This is how medications introduced to the body must first enter the body's circulatory system. Distribution. After medication enters the circulatory system, it must be distributed to the target tissue. It must be transported around until it gets to where it's supposed to, the receptors. Biotransformation. This is chemical changing from medication through metabolism. The liver is the main organ for metabolizing or biotransforming medication. Uh, we'll talk about it in the next chapter about like first pass metabolism when we're talking about drugs and like half lives and stuff like that. And the liver is responsible for that. Bioavailability is the amount of drug that is still active when it reaches its target tissue. So the bioavailability is the amount of drug that is still active once it reaches the receptor or the tissues it's going being used for. Eliminations. Medications are broken down into metabolites, and then we excrete them through urine, through respirations, feces, perspiration, and the mammal glands during lactation. Pharmacodynamics. This is the mechanism of action. It's the way specific medications achieve their desired effect. And this is an effect result of a medication binding with that cellular receptor. Receptor sites are specific sites on cells that are there to absorb substances that have affinity for a particular type of receptor, inhibit or enhance function of the cell. Agonist or antagonist. Um, Agonist means it's something that'll stimulate these receptors, and antagonist means it won't or block the receptors. We'll talk about that a little in more detail later. And affinity means its ability to um, uh, activate a substance through these receptors. How well it wants to do that, like for example, hemoglobin has an affinity, or oxygen has an affinity to bind to hemoglobin, but carbon dioxide has like a 200 times affinity, so it means it'll bind more, faster, and stronger. Um, Mechanisms of action: it binds with the receptor site, it changing the cells, combined with other chemical substances, changing the pathways. Dose responsible relationship. We have a therapeutic dose. This is our loading dose. This is to raise the level of medication to the point where it's desired effect, right? This is our loading dose. This is we want what we want the drug to do. This is our dose. Once we get that dose, sometimes we have to have a maintenance dose to maintain that therapeutic threshold. So we may have to do another dose, or we may have to um, do multiple doses, right? Or continued doses like a drip, for example, when on transfer, when we got a heparin drip or something like that. Half life. This is the time that each dose is determined how long it takes for the body to metabolize 50%, 50% of the peak concentration. So this each drug we talk about has a half life. We'll talk about like a denizen who has like a 6 second half life, which means in 6 seconds half of that drug will be metabolized. The therapeutic index is a ratio of dose of medications lethal in 50% of the population, and the dose effect in 50% of and it's effective in the other 50%. So this is our therapeutic index. We don't want to get it past that because it could be lethal. So, but it has to be close to that to be effective. Factors that influence medication: age, of course, because our body systems are breaking down or slowing down. So, um, they don't function at peak performance, so they're not going to metabolize the drugs effectively. We may have damage in our liver. Our kidneys may not work as well, so they're not going to metabolize it as well. So this could be important as a fact that we could go past that therapeutic index and we could overdose our patients. Gender and body mass, right? Larger patients may need more of the drug to get that therapeutic dose. And in pathological states, the patient with like liver disease, kidney failure, we talked about with the older patient, this can affect how much of the actual drug is being effective. Uh, an idiosyncratic reaction is an unusual reaction. So this is something that is we expect a certain reaction, but this is an unusual reaction. A lethargic, lethargic effect. It's an adverse effect caused by treatment provided. So we gave them a medication and something happened because of that medication. Tolerance is medications produce less of this as an effect over time. So that means the patient will build, you hear it all the time, they build up tolerance to this, they build up tolerance. So they have to take more and more. We'll talk about that here in a minute to get the same effect. Cross tolerances means they can build up medication to the same classification. So, for example, an opioid, they take heroin, so they fall down and get hurt, and we give morphine. It may not actually the amount we're giving them may not have the therapeutic effect that we want. Habituation is an increase in tolerance followed repeated dose. This is what I'm talking about. You build up a tolerance, and you have to continue to do more of the drug to get the same effect. Potentiation is the enhancement of one medication when you combine with another. So some drugs are stronger if another drug is given to help it. And synergism, and this is the enhancement of multiple medications when combined with another. So we we may have one drug that works okay or whatever, but then we start giving different drugs and it's working better because of the others. Storage, controlled substance tracked closely and accounted for by the DEA. When you get your advanced license or advanced EMT, and you would work on an AOS truck, and get your company will go over how you can keep track, but they keep strict records on when you give like a narcotic or pain med or something like that. Should be stored in a controlled temperature, protected from light, no exposure to air or moisture. Most of us have them sealed in a drug box. All right, chapter summary. The ability to identify medications by name and classification is important and useful. It is vital to understand how different medications work and what effects they will have on the patient. You must be familiar with the various forms of medications and how they are packaged. Stay current with medications that your patient may be taking. And we will get into more detail in the next chapter on how we give the drugs and other stuff. So please stay with us, and we will get on to the next chapter.